Hi guys, my name is Armando and I'm gonna talk about burnout syndrome. So, what is burnout syndrome? Burnout syndrome or professional exhaustion syndrome is an emotional disorder with symptoms of extreme exhaustion, stress, and psycho exhaustion. Results for stressful work situations which require a lot of competitiveness and responsibilities. Uh, the main cause of the desire is precisely overwork. This syndrome is common in the professionals who work daily under pressure and constant responsibilities, such as doctors, teachers, nurses, police officers, among others. Burnout syndrome can also happen when the professional plans or guilds for very difficult work objectives, situations in the person may find, for some reason, not have sufficient skills to fulfill them. This syndrome can result in a state of deep depression and therefore it's essential to seek a professional support in the onset of the first symptoms. So is this.
The term burnout syndrome was coined by the German psychologist Friedenberg in 1954, and at the time he worked for 20 hours a day and night. So up to the drug use experience in a clinic for drug users. A victim of the physical and mentally exhaustion, he felt also bad. The first systematic description of the burnout syndrome was performed by the psychologist Friedenberg in 1974. When I began to study more and deep, it is worth mentally that since January 1, since trouble 2022. The burnout syndrome, which many know, was the professional burnout syndrome, was incorporated into the list of occupational diseases recognized by the World Health Organization.
So, what are the symptoms of burnout syndrome? Headaches, change in blood pressure, muscle aches, stomach pains, impact on eating, isolation from the work group, lower productivity, and insecurity. Furthermore, it is important to point that there are three phases of burnout syndrome. The first one is hyperproductivity, is when the performance of the person is increased. Aggressiveness is when the person becomes very moody, and exhaustion is when the person can no longer do basic tasks.
Burnout syndromes increase more and more due to the increasingly competitive job market and the high rate of the layoffs in the country, which makes professionals feel daily pressure for better qualifications and good results. Besides the existing pressure, these professionals transform their lives at work, and when they don't get the expected recognition, they lose the stimulus to perform their function. With so much effort, it is natural that at some point the stress increases and the body gets sick, which can change course and reach a severe level of depression. The most affected professions are firemen, policemen, teachers, bank employees, doctors, and nurses, which are the ones that demand the most from the workers.
Now, talk a bit about its diagnosis. We can identify burnout syndrome through psychiatrists and psychologist specialists. The profession usually identifies the three main symptoms: exhausting, less identification with work, and a feeling of ready profession capacity, and tries to find out if they are work related. Some symptoms of burnout can also indicate depression. Therefore, the diagnosis can be complicated. But friends and family can be good pillars in the beginning, helping the patient record, then he helps. And after all, many people don't seek medical help because they don't know or can't identify the symptoms, and many times neglection the situation. But in Brazil, within the SUS, the care network is able to offer in full and free of charge manner all the treatment.
My name is Maria Luisa Cardoso, and I am going to talk a little about the treatment for burnout syndrome. The treatment of burnout syndrome is basically done with psychotherapy, but it can also involve medication, antidepressants, and anxiolytics. Treatment usually takes effect between 1 and 3 months, but may last longer.